Hello, my name is Michelle Palma, and this is my periodontal assessment project. This is Miss Wilkerson, an 82-year-old female Caucasian woman. Some personal history of Miss Wilkerson is that she was married for 50 plus years until sadly her husband passed away. He was her caretaker because sadly Miss Wilkerson was diagnosed with Alzheimer's, and shortly after, because of her Alzheimer's, she then was diagnosed with dementia, which led her to have a speech impairment. She doesn't talk much anymore and has a difficult time with the little that she does talk. She is currently taking speech therapy to help her communicate better. She is now living in a nursing home and needs help from her caretaker for most tasks. Ms. Wilkerson's medications are memantine for dementia. Her dosage is week 1, 5 milligrams orally once a day. Week 2, 10 milligrams orally a day. Week 3, 15 milligrams orally a day. Week 4 slash maintenance, 20 milligrams orally a day. Special considerations when taking medication are epilepsy or seizure disorder, liver disease, kidney disease, urination problems, and bladder or kidney infection. Contraindications of the medications are blurred vision, dizziness, headache, nervousness, slow or fast heartbeat, depression, coma. Oral effects of medications are bleeding gums, blistering and peeling of the skin, and xerostomia. For her condition of speech impairment, she is currently not taking any medication. She's only going to speech therapy. As we can see here on Ms. Wilkerson's periodontal assessment, we see that she has bleeding on probing for all teeth. She has generalized 5 to 7 millimeter pocketing for posteriors and 2 to 4 millimeter pocketing for interiors. She has furcation class 3 for 15, 19, 30, and 31. She has class 2 furcation for number 18. She also has mobility plus 2 for all her posteriors and generalized recession. For Ms. Wilkerson's AAP periodontal classification, patient presents with generalized non-plaque-induced gingival disease due to lack of oral hygiene care, reason being patient presents with Alzheimer's disease. Patient also has generalized chronic periodontitis associated with severe greater than 5 millimeter clinical attachment loss on 14 to 16 and 17 through 20. Ms. Wilkerson's ADA periodontal case type states that the patient presents with generalized bleeding and inflammation associated with gingivitis throughout the dentition due to poor oral hygiene ability. Patient has chronic moderate to severe periodontal disease with generalized 5 to 7 millimeter pocketing, with localized class 2 and 3 furcations on facials of 15, 18, 19, 30, and 31. Patient also has localized mobility plus 2 on all posterior molars. Radiographic findings support evidence of class 4 severe periodontitis with horizontal and vertical bone loss, with more than 5 millimeter clinical attachment loss and visible furcation with more than 30% bone loss. The gingival description table shows Ms. Wilkerson's gingival color, which appears generalized severe dark pink to bright red from the free gingiva and diffuse to the mucosa. The gingival contour presents generalized, moderate to severe rolled and rounded with festooned margins, and moderate to severe recession. Papilla appears with moderate to severe bulbous and cratering. Gingival consistency presents with generalized, moderate to severe, soft, spongy, and swollen gingiva. The gingival surface texture appears shiny with loss of stippling. The assessment statement is a recap of the previous 3 slides. The patient presents with dementia, speech impairment, and is a generalized class type 4. The AAP classification is patient presents with generalized non-plaque induced gingival disease due to lack of oral hygiene care by reason being patient presents with Alzheimer's disease. Patient has generalized chronic periodontitis associated with severe greater than 5 mm clinical attachment loss on 14 through 16 and 17 through 20. Her ADA case type is patient presents with generalized bleeding and inflammation associated with gingivitis throughout the dentition due to poor oral hygiene ability. Patient has chronic moderate to severe periodontal disease with generalized 5 to 7 mm pocketing. Localized class 2 and 3 furcations on facials of 15, 18, 19, 30, and 31. Localized mobility plus 2 on all posterior molars. Radiographic findings support evidence of class 2 severe periodontitis with horizontal and vertical bone loss, with more than 5 mm clinical attachment loss and visible furcation and more than 30% bone loss. The gingival description statement states that the gingival color appears generalized, severe dark pink, bright red from the gingiva and diffused to the mucosa. The gingival contour presents generalized, moderate to severe, rolled and rounded with festooned margins, and moderate to severe recession. Papilla appears with moderate to severe bulbous and crating. Gingival consistency presents with generalized moderate to severe soft spongy and swollen gingiva. Gingival surface texture appears shiny with loss of stippling. We are now going to look at Ms. Wilkerson's radiographic image. We can see from the image that she has very heavy calculus on multiple teeth. She has horizontal bone loss, vertical bone loss. She has a class 3 furcation and a class 2 furcation. In this gingival image, we can see the amount of heavy calculus visible in Ms. Wilkerson's mouth. She has her gingival color is dark pink to bright red. She has rounded margins, bulbous papillae, and gingival margins festoon. In this second gingival image, we can see the amount of severe recession that she has on her canine. She has bleeding on probing. She has blunted papillae, bulbous, and her consistency is soft and spongy. In this third gingival image, again we can see her gingival color is dark pink to bright red. We can see her receding gums, her shiny spongy gingiva, her bleeding gums, and most importantly, we can start seeing her furcation. In this last gingival image, we can see that Ms. Wilkerson's consistency is severe, spongy, and shiny. Her margins are rolled and rounded. She has severe bulbous from the gingiva margin to the papillae. She has marginal recession and the amount of calculus visible on all teeth. The dental hygiene diagnosis that was given to Ms. Wilkerson is her prognosis was poor. The rationale is because of the patient's continuous reduction in health, because of her Alzheimer's and speech impairment. The patient will not be able to keep up with her oral hygiene without the help of her caretaker. Patient also presents with 5 to 7 mm pocketing bifurcations class 2 and 3, and plus 2 mobility with horizontal and vertical bone loss. The outcome is to improve OHI and educate the patient and caretaker on how to properly maintain the patient's teeth with a healthier oral cavity. Our short-term goals are to reduce bleeding on probing, reduce the plaque-induced gingivitis, and decrease inflammation. Our long-term goal is to improve oral health care and show patient and caretaker proper OHI. We want to improve the nutrition to reduce caries risk and frequent dental visits every 2 to 3 months. At every appointment, we want to be reviewing the oral care just to keep reminding Ms. Wilkerson, as she does have Alzheimer's, so she will be slowly forgetting. The modifiable risk factors are nutritional counseling, improve serostomia, and review home care instructions with patient and patient caretaker. The non-modifiable risk factors are dementia and Alzheimer's. This is Ms. Wilkerson's treatment plan, and it shows her examinations. So the procedures were a comprehensive initial evaluation, which includes periodontal screening, a comprehensive periodontal evaluation, which is a periodontal evaluation once a year, the limited oral exam, which is problem focused, a debridement, gingivitis therapy, periodontal scaling and root planing, 4 or more teeth per quadrant, localized delivery of antimicrobial agents, gingival irrigation per quadrant, periodontal maintenance, and oral hygiene instructions. This is Ms. Wilkerson's treatment plan in a flowchart. First, we did the examination, which was limited oral exam, problem focused. For treatment, we did the gingivitis therapy. We then did the treatment of a debridement to be able to do a comprehensive initial evaluation exam. After we were able to do that exam, we were then able to do a treatment plan of 4 appointments of periodontal scaling, 4 or more teeth, with localized delivery of antimicrobial agents, and gingival irrigation per quadrant. Then for the maintenance, we did a periodontal maintenance with localized delivery of antimicrobial agents and gingival irrigation per quadrant. For the prevention, we did oral hygiene instructions at every appointment. The instrument selection for the periodontal scaling were Gracie's, we did standard, we did after 5, mini 5, and Ann Patterson. The shank rigidity, we did standard and rigid. The rationale are for light to moderate calculus removal, for fine scaling, and finishing correct. For scalers, we did standard. The rationale was moderate to heavy calculus removal. We used the Cavitron, and we used a various of insert tips. The home care recommendations for Ms. Wilkerson are the prescription dental aids, which are 0.12% chlorhexidine gluconate rinse, alcohol-free. We did Clinic-Pro 5000, which is a fluoride toothpaste. For over-the-counter dental aids, we did Biotene for her serostomia, and we did floss picks to help the caretaker have an easier time flossing Ms. Wilkerson. For toothbrushing, we did the Bass technique. The type of brush recommended is extra soft. We recommended an electric toothbrush to make it easier and cause less recession on her gums. Um, the instructions are brush after every meal for about 2 minutes and use a soft bristle brush and or use an electric toothbrush to help reduce damage to gums. The toothpaste is Clinipro 5000. The instructions are to use once daily, brush for about 2 minutes. It is used to prevent cavities and sensitivity. For floss and floss aids, we recommended a water floss if possible. If not, floss picks or regular floss. For the instructions is to make sure to insert the floss with care and to not cut the gums once inserted. Once inserted between the teeth, hug each side of the tooth with a C shape and repeat the up and down movement. The water flosser is the recommended for Ms. Wilkerson, but considering she has Alzheimer's, she might not always cooperate. The interdental aids are gum stimulator to massage the gums gently to help blood circulation in the gums. For mouth rinses, we have 0.12 chlorhexidine. The instructions are to use after brushing teeth twice a day and do not rinse with water or dilute with water. The fluoride, we recommend the fluoride varnish at every dental visit. The instructions are to use fluoride toothpaste and then at her dental visits every 2 to 3 months to get her fluoride varnish. We didn't recommend any fluoride trays since the caretaker might have a hard time placing them in Ms. Wilkerson's mouth because she does have Alzheimer's and dementia. She might not always cooperate, and we don't want either one of them to get hurt. Products to avoid commercial mouthwashes containing alcohol. So during the nutritional analysis for Ms. Wilkerson, her disease is dementia, which is caused by Alzheimer's, which decreases the memory, and the recommended foods for Alzheimer's were green vegetables, nuts, blueberries, beans, and fish. Foods to decrease are red meat, butter, margarine, fried foods. For her condition of speech impairment, there weren't any foods recommended or foods to avoid. Things to add to the diet are increased intake of fruits, green vegetables, whole grains, nuts, blueberries, beans, whole grains, fish, poultry, and olive oil. Foods to omit from the diet are decrease intake of fats and reduce processed food intake. So we want to get the most natural and healthy foods possible because it actually is good for Alzheimer patients. Things to avoid in the diet are red meat, butter and margarine, cheese, pastries, sweets, and fried foods and fast foods. Avoid high fat content. Some supplements recommended are vitamin D, vitamin B12, and folic acid, which all help for dementia and Alzheimer's. I didn't put any recommended amount because in her medication that she's taking, it says to consult with the doctor because even vitamins can have their effect on the medication. Well, that is the end of my project for my periodontal assessment on Ms. Wilkerson. I want to thank everyone that listened. Thank you.